Thank you for staying with us. You're still watching The Breakfast on Plus TV Africa. It's time to look at our second hot topic, and right now we're discussing colon cancer. So understanding the symptoms, the risk factors, prevention, and treatment. So colon cancer is one of the most common and preventable cancers, yet many people remain unaware of its risk. March is National Colon Cancer Awareness Month, a time to raise awareness about it, promote screening, and encourage early detection, which is crucial for successful treatment. Today, we bring you an important conversation on colon cancer awareness, highlighting the signs and symptoms to watch out for, the key risk factors, and steps you can take to prevent this life-threatening disease. We'll also shed light on available treatment options and the importance of early detection in improving survival rates. Our guest this morning is Dr. NESOCHI Okeke Igbokwwe. She's the CEO of NESOCHI LLC. Good morning, Ma. Thank you for joining us.
Good morning. Thank you for having me.
Thank you. So, Dr. NESOCHI, March is National, Colon Cancer Awareness Month. Why is it important to highlight this? And like it's been said, is one of the preventable cancers, but yet it's quite common because people really do not know much about it. So why is it important to raise awareness this month about colon cancer?
So it's really important to raise awareness about colon cancer because, quite frankly, we are seeing colon cancers in younger and younger populations. So our goal is to essentially try to educate the public to know what some of these signs and symptoms are, to know when you do need to get evaluated and checked out by your physician, and really just empower yourself with that information about what colon cancer is and tips and strategies to minimize and lower your risk over the course of time.
Mm. So what are some of these signs? Because, if we're seeing it more in young people, I'm sure most people don't even know what that is. And, the way Nigeria's system is, most times it's only when you feel ill that you go to the hospital. And even for some people, they don't go to the hospital. They'll rather just get a drug off the shelf. So what are some of these signs that, younger people can see to be able to prevent it?
Yeah, just to add to that, the statistics tell us that the presentation in younger people is more in Nigeria than the Western countries. So why is that as well? Why do Nigerians find it in younger people than in the Western country? What are we doing wrong?
Mm-hmm. So to address both concerns, a few things. When we're talking about signs of colon cancer or colorectal cancer, first things first, during the earlier stages of colon cancer, some individuals may be asymptomatic. Even throughout the disease process, they may be asymptomatic. So screening at the recommended time period is essential. And we'll get into that soon. But when there are symptoms that do come up, this is what you need to be aware of. Anytime you see any kind of blood in the stool, that's an indication, a red flag sign that you need to get evaluated. Does that mean you definitively have colon cancer? Not necessarily, but it is a red flag warning sign to be aware of. If you have an issue with abdominal pain, cramps that don't go away, that's another concerning sign as well. If you have unintentional weight loss, you've lost a drastic amount of weight without even trying, that can be a sign as well. If you have change in your bowel habits, meaning increased frequency of diarrhea or constipation, that is an indicator to get checked out. If you notice that your stool is narrower in size, a very thin pencil size stools, that's another sign that you need to get evaluated. And of course, if you feel like you've had a bowel movement and you feel the sensation that your bowel hasn't still emptied all the way after defecation, that is also a potential sign. So all of these are signs to be aware of. These signs and symptoms can occur in other disease states, but when you see some of these things occurring or you experience some of these things, it's an indication to get checked out. And then the other piece you mentioned, in Nigeria, we're seeing more and more individuals with symptoms. Something to keep in mind, a lot of the times there's no emphasis on prevention, essentially. So you'll know that you'll see individuals in Nigeria that present during later stages of the disease course, meaning if you are not adhering to the recommended preventive strategies, the screening strategies, a lot of the times we're noticing that individuals that we are detecting these colon cancers in Nigeria, we are seeing that they're manifesting these symptoms during the later stage of the disease when it is less easy to treat.
Okay, so one of the things that you spoke about was screening, right? And you said you have to screen at a particular time. So how often do you have to do this screening? And if, for instance, maybe genetics, lifestyle, do they also play a role in the high risk, or are there a group of people that are at a higher risk of getting this?
Yeah, so to discuss first the screening process. So essentially at a certain stage or age, and that age is 45, it's when it is recommended the initial screening by means of a screening colonoscopy. That's the recommendation. So essentially 45 is the new 50. It used to be that in the past, any individual starting from the age of 50, we initiate screening with the colonoscopies. However, because research has shown us younger populations having to deal with and grapple with colon cancer, the screening age has been lowered to starting from the age of 45. So starting from the age of 45, it's recommended that one have a screening colonoscopy. A colonoscopy is essentially a procedure where the gastroenterologist is going to evaluate and examine the colon using a scope. Essentially, they're visualizing the colon wall, looking for any irregularities, any polyps or outpouchings per se, looking for any cancers or unusual lesions in the colon. So that screening metric is essential for all individuals 45 and above. You alluded to certain risk factors. And yes, there are risk factors that can increase the likelihood that one can develop colorectal cancer. So just to go through a few of these risk factors. One of the risk factors, or the risk factors that we talk about that you have no control over, one being age. As one gets older, your likelihood of getting any kind of cancer, including colon cancer, increases. That's a risk factor that you have no control of. Another risk factor would be family history, meaning if you have a family member, first degree relative, meaning mother, father, or siblings that have colon cancer, your risk increases as well. And in fact, if you do have a first degree relative, parents that have colon cancer, we need to initiate screening at least 10 years prior to the age that your family member that had the cancer developed the cancer. So for instance, if you're an individual who had a family member, your mom perhaps developed colon cancer at the age of 50, it's recommended that you initiate your screening at the age of 40, 10 years prior to the age of that family member developing it. Another risk factor that you cannot control outside of family history would be personal history. If you have certain gastrointestinal problems like polyps, that can increase the risk of developing colon cancer. If you've had colon cancer in the past, the risk of developing it again in the future increases. And of course, there are those risk factors that you do have some control over. And that's something that I encourage all patients to really take note of. So it's shown that some of the risk factors that we have control of includes improving your physical activity. It's shown that if you lack physical activity and you do not engage in physical activity and you are in a state of being overweight or obese, that actually increases your risk for colon cancer. Other factors that you have control of, the kind of diet that you adhere to. So studies have also shown certain diets can predispose one or increase the risk, I should say, for developing colon cancer. And this kind of diet includes diets that are low in fiber, high in fat, diets that have an increase of processed meat. So we're talking about increased red meat that can increase one's risk for developing colon cancer. And of course, alcohol consumption as well, and tobacco use. So if you drink alcohol excessively, that increases your risk over the course of time for developing colon cancer. And if you're one that smokes cigarettes or uses tobacco, that increases your risk as well. So all of that to say, well, we have these risk factors that we cannot control, but you really need to take note of the risk factors that you can control. So it's important to really focus on these lifestyle modifications, meaning you're focusing on the dietary piece, the physical activity piece, living a more healthy lifestyle and eliminating certain things like alcohol and tobacco use if you are a smoker.
That really talks about prevention.
Yeah, those are things to the individuals. Now, what deliberate steps should be taken by government to make sure that the numbers are reduced? We know that the international community has been giving some technical assistance, and the government has done one or two things. But what deliberate policies would you like to see to make sure that these numbers are reduced?
In regards to policies, I think education is a key piece. We need to educate the public in regards to what exactly colon cancer is. The education piece is crucial. We need to minimize and reduce a lot of the misinformation that is out there. There are a lot of myths that are associated with colon cancer or cancers in general in Nigeria. So it's key to demystify a lot of those myths and really empower the public with that education piece. The next piece is really access. So we need to ensure that Nigerians have access to these screening tools, these screening metrics. We talk about, screening is the key to prevention, but does every Nigerian really have access to have this screening occur with the colonoscopy? If you've asked any Nigerian 45 or over, and you took a survey asking them, have they had their screening colonoscopy to evaluate and determine if they're at risk for colon cancer, I don't think we would be shocked by the response that we would get that not a good majority are having these screening tools or using the screening at the appropriate age or even during their later stages of life. So the key is access. The key is implementing education and also allocating funding essentially for preventive care in general for all Nigerians.
So finally, let's just talk treatment options. What are the options that are available? If the person has gone for screening, if they have obviously changed their lifestyle habits, what are the treatment options available for them right now?
So treatment really varies. There are a range of treatment modalities, and it really depends on the stage of the colon cancer. So when the cancer is diagnosed, one goes under the process of what we call staging. Staging occurs starting from stage 0 to 1 to 2 to 3 to stage 4, which is really the last stage, end stage, when the cancer has metastasized and really moved and spread to other areas of the body. But depending on what stage that the cancer is diagnosed, we do have various treatment modalities that include potentially surgical intervention, so surgery to remove the portion of the colon that is impacted by the colon cancer. Other treatment modalities can include radiation to the area that one is having or experiencing this colon cancer. Chemotherapy is also another option, and what we call targeted therapy, targeting the specific area with certain treatment to pretty much remove some of these cancerous cells and eliminate these cancerous cells. Depending on the stage, the treatment modalities can include all of the above, but for the most part, a good majority of individuals will have some form of surgical intervention based on their stage of the cancer.
Fantastic. We want to say thank you for coming. This is how much we can take, but we're grateful for your time and the valuable contributions you've made this morning. Hopefully, people get to, try to prevent it, get the screenings done. The government also has a role to play, and hopefully, we can just see what we can do about it. We want to say thank you so much for coming, Dr. Nesochi.
Thank you so much for having me, as always.
Have a wonderful day.
We're speaking with Dr. Nesochi Okeke Igbokwwe. She's the CEO of NESOCHI LLC, and we've just been speaking on colon cancer awareness, the prevention, treatment, and screening as well. This is how much we can take on the breakfast this morning. Thank you so much for having the breakfast with us. My name is Rume, Paulson.
And I am Nyamgul, Agaji. Have a lovely day.
Good morning.